My name is Ash Smyth. I'm Associate Professor of Nursing with the University of Canberra. I have research interests around older adults, both in residential aged care and within the community. I came to ASPiRe because a previous colleague of mine had attended ASPiRe and is a proponent of interRAI and the power of the data. And we've just started to work together quite closely, and she encouraged that I come along, get the training, and really understand the value of the data and how we can use it in our research moving forward. There's lots I've learned the last 2 days. I think for me, to be able to, I'm particularly passionate about the clinical side and supporting nurses, particularly to provide optimal care for older adults. And I think actually seeing the data and understanding how that data can be operationalized to have real impact in older adults, and both in residential aged care and community care, was quite eye-opening. The power of the data, I suppose, is what was the biggest learning for me. I think to hear about it is a different thing to actually see it in action and really understand the power it has to revolutionize clinical care. One of the things I think that really struck a chord with me was around the point of care assessment. So I think we talk a lot about person-centered care and individuals driving their own healthcare and their well-being. And I think being able to use a tool which empowers them in the moment to understand their health, their well-being, potentially their risk, is something really powerful. And I think in a stretched healthcare system, it's something I'm really interested to explore, how we can use that perhaps in the community setting and people with potential cognitive decline. That, to me, is something I'm excited to look into a bit more. I think if you have the opportunity to come along, you definitely should. I found it a very welcoming environment. I've learned lots, and there was no silly questions, which is always good. Yeah, I just think there's a wealth of information and a wealth of opportunity that perhaps isn't that well known, the value of that. And it seems a really important aspect in trying to make change with the evidence you generate and the research you do. It's a really important data point to add strength to those arguments. Yeah.
Lovely. Thank you.
You're very welcome. Thanks for having me.